Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
For ages is exercising can boost the brain mental health. And it's interesting that we've talked about many things, especially how it can affect the cardiovascular system. But this article exclusively is talking about how it can help the brain. And we've talked about how sleep can help the brain, and we've had some discussions about how exercise can help. But this was exclusively talking about how it affects the brain and how it can prevent Alzheimer's and how it can help treat post-traumatic stress disorder and virtually all anxiety disorders. What it didn't talk about though was the time requirement for exercise in order for it to help the brain, and it implied that any amount of exercise is good, and the more you exercise, the better. I think that having studies that actually document its impact upon Alzheimer's and these other mental illnesses, schizophrenia, etc., are hard to come by. And they didn't have numbers that demonstrated that it impacted. There was one study, though, that looked at use of about 4,000 adolescents in the UK, but that was the only study that gave you numbers. But it's clear that of the things we do that can help us keep clear our minds, exercise is one of them. They don't mention anything about, they talk about mindfulness briefly, but I think that combination of exercise and meditation is one that is helpful of the entire body. Any comments about that?
Yeah, Dr. Callender, we have an article for today that says, eh, well, you know what I'm going to say. You say it. an,
Oh,
article, an article today that says exercise can help elderly people with their memory of events. I think it is. Their
yeah,
memoirs.
right,
I'll put it that way. Their memoirs.
right. Yeah, it's interesting. There's also one that suggests the things that can add years to your life. We'll discuss that one too. Hey, have you heard from John Buchanan this morning?
Um, I did hear from him. He said that he would not be here today.
Oh, okay.
So I have a lineup of articles here that he wants us to do.
Okay.
Let me see if I can show them to you.
There was another article that talked again about the impact of loneliness on on survival, and talked about how um, loneliness is the epidemic of loneliness that we talked about in the past uh, increases mortality rates by 27%, pointing out that and they talk about the difference of isolation, comparing it to loneliness, and pointing out that the real enemy is loneliness, and you can be isolated and not lonely, but if you're lonely, that is what leads to increased cardiovascular disease and other aspects of it. And they have a lot of data on that, though. They tracked about 58,000 women for more than a decade to demonstrate that loneliness is an epidemic that's coming upon us, just along with the pandemic and the mental illness crisis that we're facing. And loneliness plays a huge role in that.
Well, I would offer that loneliness is mind over matter. If you don't mind, it don't matter. Um, but it's depression from feeling badly about your loneliness, about not being with anybody. Uh, if it doesn't bother you, you can be totally okay with it.
So right, I was in the hospital for 18 months when I was 15 years of age, and so I got used to being alone, and so uh, you can be isolated and be quite happy if uh, you have something to do to keep you from being lonely. And so your point is very well taken. It's a lot of your mental attitude as it relates to whether you're alone or not, because being alone doesn't necessarily mean that you're lonely. And one of the things that the group does is you can be alone in a room, but be with a whole lot of people. And there are people who, with groups of people, and are still lonely. So just like the point you're making, Darryl, is that uh, it's a state of mind. And so, John, did you find them? Did you find any? You want to start off with any articles?
Okay.
While he's looking for them, there's an interesting article on dark chocolate and how dark chocolate is associated with many of the good cholesterols and the good lipids and other things that are desirable, and that comparing it with milk chocolate uh, demonstrated that the dark chocolate was preferable. And they also talked about the fact that the light chocolate has a lot more sugar than the dark chocolate. But it does appear that there are many positive features that are associated with dark chocolate in preference to uh, chocolate that has most of the flavonoids removed.
Okay. Let's see. Do you have any?
Just start with the first one and go through all of them.
Okay. All right.
Right. It's interesting as we get towards the uh, end of February and we start March the 1st, because in DC, the mask restrictions go away as of March the 1st. And this is going to be interesting to see what happens as a consequence of that. At the Capitol Center, the one Capitol Arena, as of March the 1st, no mask restrictions are required, and so you don't need to have your proof of vaccination or anything. So it looks like we are getting back to a new state of normalcy in which people are not going to be wearing masks again. And it's going to be interesting to see if the decrease in hospitalizations and deaths from COVID continue to drop in spite of the fact that all of the restrictions are being removed. Just as the first, what happened? No, can't get the articles up, John?
Yeah, here we go. Yes,
Yeah, this is just an example of in England what they're doing, and the question is what's going to happen over the next couple of weeks, as many of the countries and states are eliminating the COVID restrictions. This is just the Prime Minister of England, who actually, I believe he had COVID as well. And he had a pretty serious case of it that recovered. So it's also clear that the pandemic isn't completely over, but the rapid rate in which the hospitalizations and deaths are decreasing suggests that it's moving in that direction. And he points out that Queen Elizabeth tested positive for COVID-19, and she's 95 years old, and she's quite elderly. Carol, what'd you say? At 95, but she's still going. Yeah, still having her meetings, and so. What are your thoughts as we start to move away from having masks and those kind of things? What are some of your thoughts about it?
Doctor, I just wondering if we're still going to have problems with bed availability at hospitals. You know, I have a friend of mine that he's waiting on a triple bypass, and he ended up broke his ankle in the meantime, you know, but he couldn't get in the hospital.
Right. Well, I think most of the elective surgery is now being scheduled.
Okay.
Yeah, because as a matter of fact, I have one of our employees whose husband is scheduled for elective colon surgery, and most of the hospitals are beginning to open up elective schedules for surgery. So we are moving in that direction. And the only other problem that goes along with that is a lot of those people, nurses who were fired because they wouldn't take the vaccine. That has decreased the workload and also factors into why some elective surgery is not being scheduled, because they didn't have staffs. So this is a part of the problem. So lifting the restrictions is one thing. That does not mean that you're not still required to have the vaccine if you work for the hospital. But any other thoughts about going to the hospital now that the restrictions, and going to restaurants, going to public places now that the restrictions are being lifted?
Well, I'm like you, Dr. Callender. I'm waiting to see what the results are going to be. I'm going to take it slow and just see how it progresses before I start really going back out in the public. But I'm going to still wear my mask. So
yeah, we have a game. We have a game on Friday, and I'm wearing my mask. So,
yeah,
but
Doctor.
of course, Friday is not March the 1st, so the restriction ends in DC on March the 1st. Because we're interested to see how the other people behave in the audience. Because I predict that most of them will not be wearing masks.
maybe it'll stop some of these protests.
We shall see. We shall see.
What about this statement, Dr. Callender? Uh, some scientists also said removing all restrictions was a risky move.
Yeah, I agree. It's we don't know what's going to happen, and I'm going to wait and see. I'll continue as is until we see what happens after, maybe about 2 weeks after March the 1st. See what is the impact of it. Because we've seen other places in Australia and other places when they lifted the restrictions, they did have increased rates of coronavirus infections. And we're going to see other articles that talk about whether there's going to be a need for a second booster shot.
Yeah, well, like a lot of stuff, it's a little bit political because Democrats are worried that the restrictions are going to cost them votes in the election this year, and so they want to lift the restrictions. But on the same time, if there's a surge in infections, that's a bad thing. But I think people are willing to just plow right through that and not reinstate restrictions just so that they can get the votes in the fall elections.
I was thinking of you, Darryl, because I watched the All-Star game, and I didn't see anybody with masks on in the All-Star basketball game. Mm-hmm. It's almost like the pandemic was past history. But well, we shall see. Chicago, they didn't seem to be very have many restrictions in Chicago. Did they have many?
Oh yeah, we had mask restrictions, and you had to show vaccine ID cards for any indoor establishment. Restaurant.
Oh, okay. So that's how. So that may be why they didn't have masks, because everybody had. Okay, I see.
Yeah, well, no, you actually you had to wear a mask. Well, okay, you wear a mask in Chicago until you actually sit down to eat or drink something, then you take your mask off. But you have to wear your mask on admission to any indoor place in Chicago. But those restrictions are off Monday, February 28th.
Well, the All-Star game was last Sunday.
Yeah, but the All-Star game was in Cleveland, not Chicago.
Oh, that's why. Okay. Yeah, that's right. It was in Cleveland. That's why. They may have different restrictions there. Yeah.
So, want to go to the next article?
Yeah, keep going. Yeah, go ahead.
All right.
Yeah.
Let me admit Barney, and then we'll go.
And California, of course, has its ups and downs. And so it's going to be interesting how they move forward, because they've had periods in which they were leading the nation in coronavirus infections. And then they had periods in which they had none. And so it's going to be interesting how things work out in California. Now, one thing that is of interest is how people are going to how this is going to affect the vaccination rate. Whether those people who are not vaccinated will begin to get vaccinated or not. It'll be interesting to see if that happens. Because we got plenty of masks now, and we'll see other articles that talk about the impact of not being vaccinated and being hospitalized and dying from COVID. Have you noticed any difference in Maryland and DC on people wearing masks recently?
Dr. Callender, I noticed that people are still wearing masks in Maryland and D.C. However, it seems like they are willing to take them off at any time, or not take them off, but just put them under their chin a lot.
Yeah, that's the same thing as taking it off. Yeah. And then you see people who wear it under their nose, which is frustrating because that's not right. But yeah, let's go to the next one because this is the same.
Okay, we're finished with this one.
Well, this kind of just points out that what we call a xenozoonosis is that other species can give us the infections, whether it's your cat, your dog, monkeys, primate models. And some of the avian flu is not new. It's a flu that has existed for some time, and this is an example of it, that there's another avian flu or bird flu that hasn't affected a lot of people yet. That's a disease entity that we have to be aware of. I think the fact that you can get infection from other species is one of the things that we have to be conscious of. Let's go to the next one.
This makes now I appreciate the great job that John Buchanan was doing with these slides.
Get out of here, buddy. Get out of here.
Don't knock my buddy, John.
Yeah, John has had a lot of practice, a lot of setting up and everything.
Now, this is an article that talks about how important your immune system is and the different aspects of the immune system, whether it's the antibody titer or these cells. And this study talks about the fact that natural immunity is when you get the infection itself, and the RNA immunity, and they sometimes have different impacts, although the combination is gives you super immunity. But the fact is that with the antibody and the sensitized cells, that the immunization is strong. The truth of the matter is, though, that over time it wanes, and so that's why the booster became important, and that's why there still is a question as to whether or not we will need a booster after another 6 months, or we need a booster after another year. And so time will tell, and that's why it's going to be important to watch what happens over the next couple of weeks as we get away from requiring masks and requiring people to be vaccinated.
Here's my personal observation. I've double vaccinated with the booster, and I had COVID in January. And so I'm feeling like my antibodies are pretty robust right now. And I have occasions a couple of times to test it when I work at senior citizen and assisted living places where I do shows. It seems like they put the person's, the requirement is that I have to sing with a mask on and the audience has to wear a mask. But they always put the most decrepit people on the front row whose
Yeah.
mask is really a chin strap, and they're sneezing the whole time. So yes, they have COVID, and they're only about 6 feet away from me. And for an hour during that show, I'm exposed to them coughing over me the whole time.
Really?
So the next day, I feel like I've been infected, and I have a little bit of sinus drainage. But the thing of it is, my antibodies are robust enough. I shake it off within 24 hours, and I'm okay. I would bet that if I did a rapid antigen test, that I would be testing positive for COVID for about 24 hours after I've been infected. So, it's been 6 months now since I had my booster. I probably have a little extension on that since I had COVID in January. Maybe that's good for about 3 months of robust antibodies. But I'm feeling like in the next 60 days, I need to probably get another booster because that's going to take me 8 months from my uh, 8 months from my booster.
Well, one thing is clear is that with a booster plus the infection, the COVID infection, that extends your period of immunity. So that I would think you'd be good for at least another 3 months because of the January infection. But it's interesting how you're testing your immunity. And so what is, and it's interesting. So at the nursing home, people who are positive still can attend the show, huh?
I don't know that they do any testing. They just let the general
Oh,
come to the show.
oh, I see. Hmm.
You better
Wow.
not make them stay in their rooms.
Yeah,
I'm
that's
working at another assisted living show this afternoon at 2:30. I worked one last week, so it kind of it's good money, but I don't know that it's worth it. It's killing me.
that's an interesting observation. Hmm.
Yeah, it's almost like suicide.
I don't know. Okay, well, that's going a bit far because he is protected.
But how are they going to, Dr. Callender, how are they going to decide whether or not we need a booster? Are they going to be testing people that have had the booster shot? Or
Actually, there's an article that's coming up that
okay.
addresses that, but the answer is that we really don't know yet. And what they're going to do is to look at people as we approach the 5 to 6 month period and retest them and see.
That's what they're going
But
to
the answer is not known yet.
Okay.
And I think Fauci and others talk about it in some of the articles that are coming up.
Dr. Cullen, I have a question. Do the antibody titers naturally wane, or are these infections causing them to wane?
The antibody titers naturally wane. So 6 months after you get it, your antibody titer may wane, but you've got memory cells that allow you to respond. But yes, the antibody titer wanes naturally. And remember, the goal of the vaccination is to prevent hospitalization and death from the infection. So We go to the next one. But I think everyone, is concerned about how soon will we need to have booster shots? Will it be something that is required every 6 months, or will it be every year, or will it depend upon the way in which the virus changes as it is with the flu? And of course, this article asks the question that we all have: is it the time to loosen mask restrictions? And it appears as though that's what we're going to be doing. But is it the right time? And I think, to be honest with you, we're going to find out.
The hard way.
Yeah, I think so. And we're hopeful that we're doing the right thing. It is particularly interesting to observe what happens in the schools, because the teachers and the students will have a unique situation there, because the teachers and the students are right next to each other. So what are your thoughts, you teachers? What are your thoughts about the impact of this on what happens in the schools with the mask mandates?
Dr. Callender, I have a opinion on that. You know, you got the students, you've got the teachers, and you got the parents. They are all in the equation, you know, because of course we know the virus can be taken from home to school, from school to home, you know, so that's an interesting combination of problems.
What do you think should be done? Should we continue to mask mandate in schools?
I think we should continue to test.
To test, huh?
Yeah, to test. Yeah, continue to test every so often. To get a test. And you know, what about the parents that have to come to PTA meetings, or even if they don't come to the building? What about parents that get um, COVID from their social events and bring it to their house, give it to the child, and then the child takes it to school? So it's a tough equation there.
You're so
Um,
right. You're
I
right.
think I think personally that this is a good system to start. And from now on, our public schools, everybody should wear a mask, just like they do in hospitals. Just wear a mask, because children always have colds. And probably in high school, you might stop it because they're not as germ ridden as they are in elementary and middle school. Middle school, it starts easing up. But in elementary particularly, let the little children wear masks. Let them get used to it. They'll be okay. And the teacher, she doesn't want to wear a mask, fine, but let the little children wear masks because they always got colds.
Is there a requirement now, and this is for the teachers, that the students are tested on a regular basis, like weekly or something like that, or they don't require that at all?
It's according which jurisdiction. I know in PG, there's a requirement per se, especially if there's an outbreak. I don't know about DC, but I know in PG, Prince George's County, Howard County, that's in Maryland, they're all together different. So it's according which county in the state of Maryland. And those two I'm familiar with.
Well, I think this is interesting to behold, to see what actually happens. And I think testing then is going to be the answer, give the answer to the question, but I don't know if anybody really knows.
Dr. Callender, I remember way before COVID, and one time you had a cold or something, and you came to our session with a mask on. I thought it was sort of strange, but then I realized you had a cold or something, and that was to protect us from your virus. And
Yeah.
maybe if we start doing that as a population, if you have a cold or something, then you start wearing a mask to protect people from getting from you. And if we just, suggest that to people to be considerate of others. If you have a virus and you don't want to spread it to others, then wear a mask.
Carol, I think I remember that. It was long before the onset of COVID. Is that correct?
Right.
It was about a month before. Because, yeah, it was about a month before because I remember what happened is that same day after the meeting, I went to my office and I fell asleep. I think that's the last time I saw Dr. Richardson. And that night I went to the hospital because I had a 104th temperature. And so they treated me with the flu medicine, and I was fine. But I remember that because I wore a mask and nobody else got the infection. But it was about a month before the pandemic.
Dr. Callender, the other thing, back
But I think your advice that Carol gave is right on target.
back when we were doing in-person group session and everything, I noticed that the transplant recipients were wearing masks too. So my question is, back in the day, how long did they want the patients, the transplant recipients, to wear masks after their transplant?
Well, as you know, none of our transplant recipients wore masks. So it depended upon the transplant centers. And some centers, they wore masks for weeks to months, and other centers, they didn't wear masks at all. So it kind of varied. I think if you have a very intense immunosuppressive regimen, then the need for masks is greater. But if you don't have anything that's strongly immunosuppressive, then you probably don't. But it varied from center to center. I saw some centers where they did wear masks. And at our transplant center, we didn't recommend masks. However, it brings up a good point that there's a lot of variation on a theme, so it's hard to know which is the better practice.
I have a question. They're saying, okay, like March the 1st, no mask. Does that still mean you stay 6 feet from everybody, or what other restrictions are they canceling?
That's a good question because it is suggested by Fauci and others that you keep all of the other restrictions. But that is not pronounced in the announcements. They just say that you don't need to wear masks. You don't say anything about the other restrictions, washing your hands and 6 feet distance, social distancing. It is probably expected that you will continue that, but it is not required.
So how will, like churches, they have every other rows, and a couple of churches I've been to, every other row you can sit in, and I guess they consider that 6 feet. And then sometimes they have every other seat or every 2 seats when you're on that row. And then if it's family, then they can all crowd up on that one row, but the row in front of them and behind them, no one is sitting on. So when are those type of rules are going to, you don't wear a mask and they're sitting up every other row, everybody's flocked together anyway. And I don't understand the rationale of this. But will people continue to do this, especially in churches?
That's a good question because I haven't heard the answer. But I think that most churches are going to continue to wearing masks until it becomes clear that you don't need to wear masks. So that's my thought, that that the mask and the social distancing in churches will continue until it is clear that it's not necessary again. That would be my advice anyway. And then it also talked about the fact that the advice actually that Carol gave, that should you get any infection, you should think of others and protect them from you by wearing masks. And that's demonstrate thoughtfulness and concern for your fellow person. Next one, John.
Well, he's getting us. Oh, okay. Go ahead.
It's interesting that this is the title of this article, because I think Omicron is leading us closer to herd immunity. Because what happens is so many people are getting infected. And so we're getting to the point where we're going to have close to 90% of the community infected, which would then give us the desired herd immunity. Of course, the price you pay is that you have a number of people dying. And as you know, we've already exceeded 900,000 people dead from COVID in the United States, with the promise, with the expectation that it'll get up to 1 million by the end of March. And so what that means is that, yes, we're getting more people infected, and so we're getting closer and closer to the point where herd immunity occurs. And theoretically, that would then wipe out the COVID infection for most people. Any thoughts about that? We've talked for a while about herd immunity, and
Doctor, does herd immunity wear off?
the only time herd immunity wears off is when people are no longer getting vaccinations and boosters. For example, with the flu, we get boosters every year. With coronavirus, we're not sure how often boosters will be necessary. But the best test of that is what is your antibody titer, and how do your sensitized cells respond to the virus when it presents itself. And so the antibodies that we had before, which were not RNA viruses or DNA viruses, waned after about 6 months or so. Mm-hmm. And with the RNA, it's suspected it may last a little longer. Some think that the DNA was actually 3 months rather than 6 months, and that the RNA is longer, but time will tell.
Dr. Callender.
But the answer to your question is, it does wane off, but the question is, over what period of time?
Yeah, I think what I was mostly getting at was, someone that's not vaccinated gets COVID, and then they claim, now I'm part of herd immunity since I had the virus. Does that wear off?
Yeah, it may be short. That they would be part of herd immunity. The only difference is maybe the high antibody titer may not last as long as it did with those who are vaccinated.
Okay, thank you.
And got the booster.
Dr. Callender.
Yes.
Does a person really have to wait until they say that it's a good idea to get the second booster? Or can I just personally think myself, if after 6 months, can I just go to the pharmacy and say I want a booster?
No, I think the CDC will come out with a statement relative to whether or not boosters are necessary. And when they make that declaration, then the pharmacy will follow suit. But it's going to be the CDC that's going to make the required regulation that will allow the pharmacies to do or not do the booster. Now, this is an interesting concept that time will tell. There may be a lot of speculation, as you see here, about whether or not herd immunity will be effective with coronavirus or not. We don't know. Time will tell. Let's go to the next one, John.
Yeah.
That's interesting. There's a second situation in which the Supreme Court was challenged about the vaccine mandate. And once again, that was supported. Now, the question is, after 6 months to a year, and this is tested again, will the Supreme Court still accept the vaccine mandate? And only time will tell. But I believe that people will test it every 6 months because there are those who just don't want to take the vaccine. And it's going to be interesting to see how the Supreme Court votes. It's a pretty wide margin, 6-3. So it's going to be interesting to see 6 months from now whether they will still accept because I'm sure that somebody is going to challenge it within 6 months. I wonder which side Clarence Thomas was on. Do you think we'll ever get another Black Supreme Court justice?
No, we're supposed to be getting a woman.
Yes.
A black woman.
Soon.
A black
black-
woman. Yay! Got one as vice president. Now we get one on the Supreme Court.
Yes.
Well, no,
I
no.
know we'll know how. She'll take care
Yes,
of Clarence
He hasn't
Thomas.
made it. He hasn't made a decision yet.
I know,
But he
but he
will.
got 3 of them.
He will soon, and sounds like it will be a Black woman. That's who they're looking at right now.
That's
That would
what
be
he
great
promised.
because the
But
black
she
man
will
has
still
been a
have-
disaster.
But she'll still have to be voted through, right?
Yes.
Yep.
And we've seen how Republicans do as far as dragging their feet or
Right.
running when they want something.
Mhm.
Right. So it's going to be interesting to see who he comes up with and how they respond.
You know, she's a black woman, they ain't gonna respond well.
Let's hope that we look beyond complexion. However, you want to be realistic about it, huh?
Yeah, I'm being realistic about it. You know,
The Republicans went to the 50-50 rule to get Kavanaugh on there, so the Democrats can do the same, but then they still have to worry about their 2 Democrats that look like Republicans most of the time.
Well, we shall see.
Yeah, we shall.
Let's go to the next one, John.
Okay.
John is getting better. They're coming faster and faster.
Okay, you spoke too soon, baby.
Cheer him on, Carol. Cheer him on.
That's my man.
I'm in
That's
your
right.
corner too, John. I'm in your corner too.
Oh yeah, I with a little bit more practice, I would be up to John Buchanan.
This is an article that talks about 73% of the United States is immune. Now, that's interesting. It's nice to see that, although we'd like it to be higher, but
Mhm.
you wonder with so many anti-vax people, what is the maximum we're going to get up to? It'd be nice to get up to 90%.
And they are including the children in this,
No.
No?
No, they don't. No.
Oh.
They're mostly talking about adults.
Oh. Okay.
Dr. Callender, what happened to the rubber gloves?
Say again?
What happened to the rubber gloves?
You notice that nobody's, I have one person in my choir who wears gloves. Nobody else wears gloves. And I haven't seen any comments relative to whether or not we should be wearing gloves, so that it seems it's because it's inhaled virus that most people are not wearing gloves anymore. How about in your church? Do you have anybody who wears gloves?
Not even the elderly women who used to wear gloves all the time. It hadn't been for about a couple of decades, but, or maybe a half a century, but no, not really. Maybe the nurses who are fake nurses are wearing those rubber gloves.
You funny. Dr. Callender, I asked my primary physician about wearing the gloves, and he said it really, you shouldn't wear the gloves because you're still touching and you can pick up anything, and so it's not really protecting you. That's how it was explained to me.
Yeah,
It's
and I've heard a number of people who talk about the fact that some people forget that it's a two-way street,
Mhm.
and that the gloves can take germs and give them to you, as well as that, so that it's a two-way street. You have to recognize that, otherwise you will be infecting yourself with other
Right.
germs.
It's like
That's what your
cross-contamination.
doctor's talking about.
Yeah, it's cross-contamination. So it's like when I pump gas, I will wear a rubber glove when I pump gas, but before I get back in my car, touch the car, I take it off and throw it in the
Take it
trash.
off and throw it away, right?
Well stated, well stated.
Mhm.
Well, the few of you who still go to fast food restaurants, and I think I'm gonna quit, but the person that takes your money, they got on rubber gloves. And then sometimes at a window, especially like Wendy's, which I don't go to, they take your money at the same window and give you the food, same window with the same rubber gloves on.
Mhm.
So
Right, that's
just
right.
like
Makes
the
sense.
Lord said, cross-contamination.
That's right.
And I'm looking at them like, who are you fooling? You know, they got all these rubber gloves and they're touching everything. You
Well,
know,
they think they're doing the right thing. They
because
think
they
they're
got
doing
all
the
these
right thing.
gloves to
But-
protect their skin.
Yeah.
Yeah, Dr. Callender, don't forget that they are also handling money. And you remember back when it first started, we were precautious about wiping off our groceries before we brought them into the house, the bags rather. And also, I know people who left their mail outside, for a while, wiped that off before they brought it in. What is the thinking on all of that now?
I think it's not necessary. But we recognize that money is contaminated. We know that. But I think it's not necessary, period. That's all. We did that because we didn't know any better then. However, we know now that that's not the source of the virus.
But with human
But
nature,
those
I
people
never
who are germophobic, there's nothing wrong with being careful.
right, but I never even saw germophobic people refuse to take money.
I know, we didn't call it, but I live with a woman who is germophobic, and all my children have been trained to be germophobic. So, it's sensible to be protective. But as far as coronavirus is concerned, That is not how it's
Spread.
spread. It's not how it's spread.
Yeah, Dr. Callender, when I got my liver transplant, I was told that I could catch anything from anybody at any time.
That's correct. Yeah.
Mm.
That's true when you're, especially in the early days of immunosuppression, the first week or two, you are highly immunosuppressed. And so that's when you're most susceptible. Let's see the next one, please.
Okay. That's the same one. Sorry about that.
We didn't see it.
Okay. Let's see what we can do about that. One second. Betty Blaylock keeps getting bumped out for some reason.
Mhm.
Ah, see, Carol, I told you spoke too soon. Mm.
I didn't want to say that, but we still support you. It's coming.
All right.
Patient and long suffering. Funny how patience and long suffering becomes easier the older you get. When you're 20, you have no patience. And as you age, you become more patient, and you look at younger people and smile at their impatience.
Okay, let's see. This is the article I'm trying to pull up. It won't pull up for me. It's scientists successfully converted donated lungs into universal transplant organs. And it
Right, that's the article, right. You
yeah,
can't pull it up though?
it's not coming up for me. I'll keep trying. Oh,
Well, what this is,
here it is. Here it is.
right, okay. Yeah, this is amazing, although it's only with the lung so far. You know, we've seen a number of advances over the past 6 months. We have xenotransplants because of the ability of them to have pigs that the rejection carbohydrate is removed, and therefore you can have a transplant from an animal. Now we have a situation in which lungs are transplanted regardless of the blood type. This is absolutely phenomenal because it means that no matter what your blood type is, you can have a lung transplant. And that is a remarkable feat. Now, the question is, will we be able to do this for other organs as well as lungs? And of course, this is the first one. So we've got to see how this works with the lungs. We've only had one, so time will tell. But this is a remarkable accomplishment, which will mean that when you get a lung transplant, regardless of the blood type, you can transplant that into somebody else. And so this is a remarkable accomplishment that, and so we've got two remarkable accomplishments. We have a kidney xenotransplant, and you had a heart xenotransplant. And now you have a situation in which they're able to convert lungs that were maybe B or A to zero, which means they become the universal donor. And so whether this will be applicable to the heart and the other organs remains to be seen, but this is a tremendous breakthrough. So we have a number of breakthroughs, and I think all of this is essential because we have 17 people dying every day because of the shortage of donors. Anything we can do to make more available donated organs is absolutely wonderful. You have over 100,000 people waiting for transplants, and we only do 40,000 transplants last year. So it's a phenomenal accomplishment, especially if it becomes applicable not only to the lungs, but other organs as well.
Is the fact that people are living longer, does that reduce the transplant, people being able to give their
Well, age is not a contraindication to transplant. Having comorbidities is. In other words, if you're able to successfully receive a transplant, then age is irrelevant. But if you get many other problems, complications, infection, or disease states, then that becomes the obstacle. But age in itself is not a contraindication to transplantation.
No, well, I mean the fact that people are living longer, there aren't that many live donors, I guess is what I'm trying to say.
What was the question again? I
If
thought you were saying.
If people are living longer, I know there aren't as many live donors as, someone who passes that you can use their organs. So if people live longer, does that kind of slow down
No, it's the age is not the issue. The issue is the other diseases that they have as they age. So if they have a number of other chronic illnesses, that would be the feature. So in a way, the answer is yes, because if you get older and you have more diabetes, more heart trouble, more other diseases, then that would mean you would not be a transplant candidate. You could still be a donor of tissues, but in terms of organs, probably the oldest organ donor we've had is probably about 80. Tissues, you can be up to 100. So, but for organs, 80 is probably the oldest donor we've had. But that's because most people, when they get older, they have other chronic illnesses. Does that answer your question?
Yeah, sort of.
Yeah, the other thing too, Dr. Collin, I want to ask on that same subject is that when people are living longer, and let's say without comorbidities, does that would naturally increase the donor pool? Is that correct?
Yes. The problem is that most people who live longer develop other chronic illnesses. And so it may work against it. But in general, if they live older and do not develop chronic illnesses, yes, that would increase the donor pool.
Right.
Okay.
That's kind of what I was getting at. Yeah. Okay.
Yeah, I just renewed my driver's license because I changed address, and I checked the box to be an organ donor. But
Hey.
okay, but like I'm 72. Next month I'll be 73. If I were somebody that needed an organ, I wouldn't want an old organ like I'd be donating. I'd want something much younger.
It's interesting that that's an interesting observation because many people have discussed that point. And it's interesting that the younger organs are actually less likely to be rejected, and the older organs are more likely to be rejected. So that your desire to get a young organ is makes sense. But we have not factored that into the equation for the most part. We give you the organ that is available if you desire to have it, regardless of age. But your observation is correct that the younger the organ, probably the healthier it is, and the less likely you are to reject it.
Dr. Callender, at one point they were saying they wanted to give out age appropriate organs.
That's
If
correct.
if you were 65 or so, then maybe they could get you a 60-year-old, 70-year-old organ.
Yeah, that for a time that was thought to be desirable. Over time, that has ceased to be popular. But there was a time when that was important, and they gave you an age appropriate organ. But that is not as popular as it was at one point. But anyway,
Yeah, I guess
Darryl's observation is a good one.
Dr. Callender, I was reading on here about the type O. How many people on this panel know what their blood type is? Because I don't.
I'm O positive.
I'm A positive.
I'm O positive.
I think I'm B. B
So
positive.
everybody but you, Carol.
Oh, everybody knows but me. Okay. I'm gonna find out, so the next time we come to this, I'll know. I'm the only one that doesn't know their blood type.
Yes.
Yeah, I don't know either.
Okay, thank you, Kevin.
All right.
I
know
have
it's
a
red. I
card.
know it's red.
I have a card that I carry in my wallet with my blood type on it.
Go,
That I
Kevin.
got from my doctor's office.
Yeah, okay.
John, what is yours?
I was afraid you were going to ask that question. It's been 30 years since I knew. I didn't care.
Well, okay.
I'm a donor, so you have to know what it is.
All right, so that's that one. We're gonna go to the next one, Dr. Callender?
Yes, please. Yes, please.
Okay. All right.
It's interesting. We talk about the things you need to know. You need to know your cholesterol level, your blood sugar, your other levels. We don't talk so much about your blood type. And it's interesting. It's good to know your blood type, though.
I only know mine because I'm a blood donor. It's nothing what the doctors told me.
This is the article we were talking about earlier, right here, coming up in 1 second.
Yeah, this is the article that shows that us older people can retain our memories if we exercise. And which fits in with the article we talked about in the newspapers about the impact of exercise on mental health, on the brain itself. And as this article talks about exercise about 3 times a week. Of course, it doesn't mention the fact that it should be at least minimum of 30 minutes a day, actually 5 times a week. But anyway, for the brain, they're saying the minimum is 3 times a week. Most of us exercise more than 150 minutes a week, but that's the minimum that is thought to be. And of course, this does not address the issue of weight bearing either. Somebody had a comment?
Yes, we were talking about sleep. And as you get older, it seems like, particularly when we're in church, older people sleep. And I don't know, is it blood pressure medicine or what, or if you're a deacon or what, but they go to sleep quite often in church. and seem like they should wake up very bright.
I think they
So,
go to sleep a lot in church because of the sermons.
no. But you do see older people, whether in nursing homes and etc. And I don't know if it's medication, but they sleep a lot, but they don't seem to, their memory doesn't bounce back as much. The older you get, the more you sleep, I think. Is there
The
any
more
study
what?
on that?
What are you thinking that you need more sleep as you age?
No, I see a lot of elderly people, and I can use that terminology. It seems like the older they get, the more that they are sleeping, or some of them. Has anybody else observed that they fall asleep? Because I was at church Sunday and it was a lady next to me and a drop of a hat. And that's happened to me before. And I don't know whether it's blood pressure medicine or what, but you just sleep instantly, especially when nothing is going on.
I think it's just in church. I think it's, as John said, the sermon. I mean, really, church, you said in church. If you're falling asleep in church, then that means you're not interested.
Amen.
But I've seen them I've seen them just sitting up there. And a lot of people are sitting around and you see a person and they're talking and they just nod off to sleep.
Oh, whether they're in church or not, just in a.
They just nod off.
Yeah,
I can't answer that.
I think probably we're all guilty of that.
It's some type of disease or something, Dr. Callender, that you have that makes you you can be sitting up talking and then you just fall asleep.
But I think what Carol mentioned sometimes can be related to those people who are on some medications. But I think I've had the same observation that Carol has had, that, but I don't know that it, and I've seen it more in the older people. So I've seen the same thing. I don't know why, but I do know that it's true.
Or we can just keep it simple and just say they're tired.
I like that.
Yeah, but
I think it's more
you see the
medicated.
nodding. You see the nodding in churches a lot.
I think it's more medication as far as, especially in
Some
church.
people have narcolepsy. That's what it is. That they can just be sitting there. Because I know a lady that did that. She's sitting there, she can talk to you and she looks like she's wide awake. And you look again, she's asleep.
I got one. Yeah.
But not the whole deacon board.
Now, I agree with you there, Carol. They're just not interested.
Okay, well, there's a little question that the observation is accurate. No, the mechanism by which it is operative, I don't know the answer. Let's go to the next one, John. You're confusing us.
Okay.
Yeah.
Let me see if this is the same article. Hold on. Yep, same article. Sorry about that. One second.
We're not going anywhere.
Well, this is the article that Fauci talks about inching back towards normality. And what he's really saying is that we really don't know what's going to happen. And so we need to take baby steps in moving until we actually get more information. So that as we start lifting mandates and other things like that, we should be careful as we, and we probably ought to do one thing at a time, do the mask one time, do the social distancing and other things, little by little, until you get to the point where when we look at the daily averages, the numbers are still decreasing. The numbers are increasing great now. Will that happen as we stop doing masks, as we stop doing social distancing? as we stop doing hand washing. And I think it's clear that those are practices that we should adopt forever, so to speak. In other words, we should be hand washing, and we should be being conscious of social distancing. And as Carol said, when we have infections, we should wear masks. And so those are things that will allow us to make the changes that are necessary without having an increase in infections. But the proof of the pudding is in the eating, so we have to just do it little by little and then see what happens. The good thing is that right now, everything is moving in the right direction, but we want it to stay that way. And so. And then you're going to see another article that talks about how it's mostly the unvaccinated that are having the COVID infections that require them to be in the hospital or to die. Let's go to the next one.
Is
Now,
this it, right?
This is the
Is
one.
this it?
Yeah, this is the one that talks about a second booster shot, which has not been stated yet, but it's possible as they do more studies that we may need a fourth shot by the fall, which implies that we're going to need annually at least the regular flu shot and the COVID booster shot. That's the thought. Now, we don't know exactly, but it's this article implies, and most of our studies that we've done suggest that we may likely result in needing annual boosters for the flu shot and COVID. Time will tell. As you can see, we're up to 936,000 already dead from COVID, which is every death is a new record, because the record before was 675,000 from the Spanish flu, and we're rapidly approaching 1 million. Next slide, next one, please. Next article, please. This is the article that talks about the fact that the natural immunity has enduring strength, and the RNA as well has antibody titers that are very high. And when you have the combination of the natural immunity and the vaccinated, then you have what they often call super immune. And so this then is desirable but I think, as Kevin asked before, how long will it last? And that's the question that remains unanswered, and time will tell. Let's go to the next one, please.
Okay. This is the last one.
Well, we did this one already. So.
Okay.
Yeah.
Yes, the last one.
All right. Okay. Any comments about any of these articles that you think we need to discuss a little bit more, or any questions that you still have?
No,
How
Dr.
many?
Callender,
Yes.
mine's just an observation. My old employer, 35, 4,000 people. And each month they put out a newsletter, who retired and who passed away. And we had like 13 people pass away last month when we usually average about 3 or 4. And someone that works in the office had told me that, they're in the know, but they were able to say most of them are COVID related.
Yeah, and there's a paper that talks about, we talked about last week, that the deaths in the people over 65 and over is so much higher than below 65. And then when you get up to 70 and 80, it becomes astronomical. So that it's so important that people above 65 get vaccinated.
Dr. Callender, I've been noticing a lot of people in my age group are falling like flies, and some people even younger. So I'm scared.
Well, as they say, the wages of sin is death, and the gift of God and Jesus Christ gives us eternal life. But so we're all dying. The only question is, when we die, when are we going to die? So it's not a matter of are we going to die? It's a matter of when we die. So enjoy life, live to the best of your ability, and enjoy it because today, nor tomorrow, is promised to no one. So
That's right.
yeah. So enjoy it as you go. Take one day at a time, or maybe take 1 hour at a time. I had a guy.
1 second.
I had one of our colleagues who said, "Life is short. Eat the dessert first." Which I thought was interesting. But of course, anyway, I always thought that was an interesting observation that he made.
That is interesting because that's what I've been doing. It's been giving me diabetes.
Don't be buying no green bananas.
What's wrong with green bananas, Kevin?
They take too long to ripe. You might die before they ripen up.
Janice, any comments, special comments as we approach the end of February and the beginning of March?
Any comments?
Yeah.
Comments, yeah.
Nothing in particular.
Okay. Well, I just think of David and
No. Chris and I had a serious conversation about that the other day. We're coming up on 2 years. And this is when he and I both agreed there's no time limit on grief. And
maybe 100 years. Maybe 100 years.
Maybe. You go through it, you get through it. Day at a time.
Right.
Yeah. So.
Okay.
Dr. Callender, I just referring to Janice, because I was thinking about that. I went to a funeral of a colleague last Friday, and sometimes every once in a while it hits me, about death and sobering. And then there's time you get a lot of friends that are passing, especially since all of us are getting near the age where I don't want to face it or it's too depressing. I just want a brief spell of it. Thinking about doctors, when do they don't get immune to death, but when do they get sort of not comfortable, but you know what I mean? Or when does it first hit them?
No, I didn't understand your question.
They never get comfortable with death, doctor.
Or is there ever a time in a doctor's life where he's tired of his, death affects them, so they want to take a brief vacation, or they just want to shut down for a second?
Yeah.
Burnout. You're talking about burnout.
Uh-huh.
And You know, I've read a lot about burnout, and I don't know why I never experienced it. And I was in the field when I first started in transplantation. The death rate was about 50%. And as a doctor, I cried after I lost every patient. And I recognized that it is important to do your best every single time, because I recognized what is obvious to everybody else, that we don't have the power of life and death. So therefore, it is required that we do the very best we can all the time and understand who has the power of life and death, and it's not us. And so therefore, as I talk to my students, I emphasize to them that you must give it your best shot every time, because that decreases the agony that is associated with death of patients. And I recognize that in your efforts to save lives, sometimes you save lives, sometimes you accelerate the death of patients. And so therefore it becomes very critical that you give it your best shot every time. The one thing that can accelerate burnout is these so-called malpractice lawsuits, in which people who are doing the best they can make mistakes, and all humans make mistakes. And then you're treated as though you are a criminal. And so that has been a reason why a number of doctors have stopped practicing. So it's not if you understand the fact that you have enough knowledge to do the best you can to save some people's lives, and not think that you have a so-called God complex, then you're less likely to be involved in that burnout situation. Now, the other thing that has contributed to the burnout is all of the paperwork, that billing and all the other things that go along with the practice of medicine. And this has caused a lot of doctors to stop practicing medicine. Does that kind of help answer your question or not?
Very
That
much
is,
so.
that is fantastic.
Sure is.
Because sometimes when I play for funerals, as long as I'm not taking it personal, you know, you're playing for a funeral and not get involved, but when that person is close to you or something like that, and I guess taking that responsibility, the burnout, you know, and sometimes the paperwork, even in teaching, that paperwork, you're held accountable if a child cannot learn and they're under your tutelage, then you're held responsible for them lack of learning. And I guess the same thing with doctors. If a patient died, and I used to be like that. When my mother-in-law died, I blamed the doctors for her dying and not realizing it's all under God's control. So when we blame other people and start suing them and everything, we're actually making it worse. But we as a society, we always think that mankind is in charge. And we blame doctors for people dying. Somebody has an accident, you sue them because they said they did it on purpose, you know. So we always had this mind thought, is your child is born with a birth defect. Whose fault is it? They try to blame the parents. Then they try to blame the doctor. We as a society, we got to blame somebody for it. And used to be, we didn't blame it. That's just the way they were born that way, or they died. Why they died? Now every death in America, you got to figure out why they died. They just didn't die. You got to have some reason. And the first question, they passed. Oh, what did they pass from?
That's true.
And then we try to put the blame on somebody. Well, they killed themselves.
Yeah.
Well, that's why when you choose a doctor, you choose. I've known, I want to say Dr. Callender most of our lives, and I know the trust that I have in him. But Dr. Callender brought up my husband, and when he had to have this serious surgery, you did the research to choose that doctor. If you didn't like one particular doctor for any reason doing your research, you'll say, well, he's not the one. And then when you decide on one, you put all of your trust in that doctor and you go by what they say. And when you just spoke of burnout, I felt like I didn't really know that doctor, but in that period of time, 30 days or so, oh yeah, I got to know him and we got personal, we got friendly. But when you see that doctor show emotion, I wanted to say, he doesn't know me, but he feels emotion anyway. He was sorry anyway. I want to do more anyway. And that last day, it's still, I'm going to, and then you come to a point where you know it is God's will.
Mhm.
And it's nothing that you can do. And you can't just keep plugging along and not getting the results that you want. But you do the research, you find a doctor, you trust that doctor, and it's in his hands and God.
Very well said.
Darryl, any comments?
Yeah. Okay, what I notice is that Dr. Callender has a very healthy respect for life, which is important because what I mean by that is what life is a gift, and it's the most precious gift that we all have. When you're entrusted with somebody else's life, those are additional gifts. But what that gift means is that you have a responsibility to treat it with respect, which means always doing your best. And so we're not doctors, except for Dr. Callender, but with the gift that we've been given, we have a responsibility to treat the way we handle our life by doing the best. And by doing the best is everything that we talk about. It means doing the best practices so that you get the best sleep, so that you eat the best way possible, so that you do the best things to relieve stress from yourself, so that you do your absolute best in taking care of yourself and others. And when you do that, then things like blame or burnout, they're not issues because the only focus is whether that you treat this precious gift called life by doing your best.
Mhm.
One other thing I have to go back to, and this is something Dr. Callender said last week, and I kind of wish he had pushed me in this direction with my husband. You said always think about having an autopsy. I think that's important now. Would it have made a difference? No, not at all. But, you know, sometimes I do have second thoughts. It wouldn't have changed anything, but with certain illnesses, I think that is a consideration. I think we should think of that first. I thought of it much later. I was asked if that was something I wanted to do. I chose no, because he had been through too much, and it wouldn't have changed anything. I have my doubts about the cause of his death, but it would not have changed anything. Maybe I should have, second thought, asked for an autopsy. It's too late now.
The thing about autopsy is that it isn't always for the person who died, it's for the family that remains.
Absolutely.
That's right.
And
Absolutely.
now I see that. You're right. Absolutely.
Yep.
Peace of mind.
When my husband died and the coroner called and asked me, she said, well, we're going to perform the autopsy. And when she called back and gave me the results of the autopsy, that his death was caused, it was an accident, but it was because of the fall that his body had internal injuries that would never heal because of the fall from work. So it was related to the accident. Well, I would have never known that. I would have just thought that he died because, but when she said, well, no, everything happened because of the accident at work. So it did make a difference, and it gave me a sense of peace.
Well, I think we've heard from Darryl, so
One
Uh,
other thing, I'm going to show this to my cousin. I told you I have a cousin who was a pediatrician in her 50s, and she got burned out. And I think she was working with youth, and she was taking everything upon herself as whether or not they recover. And we talked about this before, like psychiatrists, because it takes so long for the human mind and all these psychoses to heal, that they take it personally upon themselves that these people are not healing or getting well. And I think my cousin did the same thing. So maybe just by listening to this can release some of that stress and that burnout feeling. You know, when you know somebody that's burned out, they're taking everything upon themselves as if they caused it.
well, I think we've had some profound statements today, and I've enjoyed listening to all of them. You know, I learned so much from you, and you may learn from me, but I learned so much from you, and it's such a joy and delight to be with a group of people who are so wise. And so have a good week.
Thank
You
you.
also.
See you
Thank
next
you.
week.
Thank
Stay
you,
safe.
doctor.
Thank you.
Thank
Dr.
you.
Be safe, everyone. Bye-bye.
I'll see you.
Bye-bye.
Have a great day.
Don, don't forget to stop recording.
Okay.
Bye, Rochelle. Bye, Betty.
Hi, John. Is this what you wanted me for yesterday? You're muted.
John, you're muted. You're still muted.
All right, now I'm not muted.
Is this what you wanted me for, to try out your?
Yes, yes.
Why didn't you call me back and tell me? You know, he wasn't on the computer that long. You
I
should've
thought he was
told
going
me.
to be on the computer for the rest of the night.
No, you should have said, call me when he get off. I didn't.
I practiced with Carol for about 5 minutes.
But I wasn't good enough.
No, that's not it. She doesn't want to stay on the computer but so long because she has so many other things that she wants to get done.
Yeah. Well, you know, you should have called me back and said, I need you, get on. Yeah, I would have
Oh,
gotten
yeah.
I would have gotten on.
No, I thought, what does he need practice for?
Now you know.
Yep.
I just thought he could do it. And just click a button. There it goes, man.
Carol, did you hear Charles tell you hello?
No. Hey, Charles, it's nothing but the four of us now. That ain't being recorded. Tell him to show himself
Show yourself.
and be accounted for.
When the article came up about